For some children, movement doesn't come naturally. Sitting, crawling, and even taking a single step can be a challenge. Pediatric physical therapy helps children with movement difficulties reach their fullest potential through guided therapy, play, and functional training. Physical therapists work with children who have developmental delays, neurologic conditions, or even congenital disorders. These may be caused by problems in the brain, spinal cord, or muscles that affect how a child moves, balances, and interacts with their environment. As a result, children may experience delayed milestones, poor coordination, muscle weakness, or abnormal movement patterns. Child development follows a predictable sequence of milestones, beginning with head control, then rolling, sitting, crawling, and eventually walking. When these milestones are delayed, it may indicate the need for early intervention. Birth, babies rely on primitive reflexes, which are automatic movements controlled by the brainstem. Examples include the rooting reflex and the Moro or startle reflex. These reflexes should gradually disappear as voluntary control develops. When primitive reflexes persist or when abnormal reflexes are present, they can interfere with posture, balance, and coordinated movement, making it more difficult for a child to perform everyday activities. This is where pediatric physical therapy plays a vital role. Physical therapists assess movement, identify impairments, and create individualized treatment plans tailored to each child's needs. Through exercise, guided play, and functional activities, we help improve strength, coordination, balance, and overall mobility. You might think therapy is just exercise, but for children, it's so much more. It's about turning play into progress and small movements into life-changing milestones. In pediatric PT, we don't just treat conditions, we help children explore their world with confidence. Every stretch, every step, every activity is designed to support growth and independence. We work closely with families because progress doesn't only happen in the clinic. It happens at home, in school, and in everyday life. Early intervention is powerful. The sooner we guide movement and development, the better the outcomes for the child's future. As physical therapists, we are not just clinicians, we are advocates for every child's ability to move, play, and participate. We celebrate every small victory because for a child, even the smallest progress can mean a big step toward independence. Through creativity, patience, and evidence-based practice, we help children reach their fullest potential. And most importantly, we bring hope not just to the child, but to the entire family. So what are you waiting for? Let's move, play, and grow together. Choose a profession where every small step makes a big difference. Choose physical therapy. Be the reason a child takes their first step, their first jump, and their first run. Join us in shaping stronger, healthier, and happier futures, one child at a time. If you're looking for a career with purpose, passion, and impact, this is it. Physical therapy isn't just a profession, it's a commitment to changing lives. Start your journey today because every child deserves this chance to move freely. Start your journey today because every child deserves the chance to move freely and freely. Start your journey today because every child deserves the chance to move freely. And maybe, just maybe, you could be the one who helps them get there.